Welcome, everybody. We are so pleased to have you all here this afternoon for a Facebook Live conversation with Representative Palmer from Alabama. Really appreciate you all getting on the line and definitely appreciate Representative Palmer joining us today. Welcome, Representative Palmer.
Thanks for inviting me.
Absolutely. I'm going to introduce myself real quick and then introduce you. My name is Ted Ellis. I am the Director of Coalitions at Americans for Prosperity. Americans for Prosperity is a national grassroots organization with brick and mortar chapters in 35 states. And we are very fortunate to count over 3 million grassroots volunteers in our membership. And we work on issues such as taxes, spending, keeping government fiscally responsible. We also work on free speech, criminal justice reform, and of course, top of the line issues like healthcare. And we are very grateful to have Representative Palmer on. Representative Palmer is a member of the U.S. Congress, sits on the Energy and Commerce committees. It is his second term chairing the Republican Policy Committee, and he is formerly the founding director of the State Policy Network, which is an organization that supports conservative and free market think tanks across the United States. Welcome.
As I said, thanks for having me on. Look forward to a good discussion with you on healthcare policy.
Absolutely. We're going to have a top-notch discussion. So, Congressman, let's dive right into it. Our activists, many of whom are on this call, have been, very active on the issue of healthcare. There's been a healthcare crisis, a pandemic that's been really affecting a lot of people across the country over the last 18 months. Americans want a healthcare system that awards them the choice and control they want, the affordability they need, and the quality they deserve from medical professionals they trust. Now, unfortunately, many folks in DC are moving away from what most Americans want, which is to fix what's broken in our current system and improve the status quo. Why are they doing this, and what are they trying to accomplish?
Well, when you control healthcare, you can literally control people's life decisions. And what we advocate here is giving people, first of all, the right to make their own decision about the healthcare, but to restore the patient-physician relationship. And a lot of people lose sight of how the Democrat healthcare ideas impact the physician's ability to deliver quality healthcare. This is an area that when I ran the think tank, we were involved in going all the way back to the 90s with Hillary Care. And we understood very clearly where our healthcare system would go if the government took it over. So we've approached this in kind of a segmented way. And I really start with, first of all, answering the Democrats' arguments about that we don't have a plan for covering people with pre-existing conditions, or the out and out lie that we take away coverage for pre-existing conditions. In 2017, when the Republican House passed a healthcare bill, I wrote the amendment that set up guaranteed benefits pools to cover people with pre-existing conditions, which was modeled, by the way, after the legislation that was passed in the state of Maine. And I think the idea originated with the Maine Heritage Policy Center there, the think tank in Maine. But I think the most important thing we can do, Ted, is to really expand health savings accounts and to put people in charge of their decision-making. And the way I would do that is that the money would be able to be rolled up, that you don't use, can be rolled over year after year. It could earn interest or other earnings. You couldn't speculate in the stock market, and it would be tax-free. So that if I use it for simple math, if you had a $5,000 deductible on your major medical plan, that your premium, instead of paying premiums, it would go into your health savings account, and what you don't use would roll over. This would be especially attractive for young people because they rarely go to the doctor, but they would have coverage. It would reduce the administrative cost for physicians by probably at least 20%, and would bring down cost. It would create a more competitive marketplace in healthcare. And as people grew older, approached retirement, they could have several $100,000 in their health savings accounts they could use to pay for long-term care, to pay for their dental. They could, whatever they used for healthcare would not be taxable. And when they passed, that money could then be passed on to their heirs. So I think the key is giving people the ability to make choices, to choose their doctors, to actually restore the patient-physician relationship. And you'll not only bring down costs, but you incentivize people to live healthier lifestyles, which at the end of the day, what our real objective should be is to improve outcomes. So, you know, I love it when I get asked by a bunch of left-wing reporters, well, what's your healthcare plan? And my answer is, how long do you have?
That's fantastic.
I have to tell you.
That's truly fantastic. And you know, at Americans for Prosperity, we talk about this contrast between Medicare for all, the public option, and what we think is the way forward, which is a personal option, an option that's built by you and your doctor, and where government gets out of the way and allowing you to find the healthcare that works best for yourself and your family. And we totally agree that HSAs are a great part of that. Let's dig in a little deeper, if you don't mind, and talk about this pandemic that we've been going through over the last year and a half. There have been an enormous number of lessons, I think, that have come out of the pandemic, from the regulatory barriers that stood in the way that people didn't realize and stopped people from getting the care that they needed. What would be your prescription moving forward? How do we best move past the pandemic while still taking away the right lessons from it?
Well, there are a number of things that we learned from the pandemic, starting with access to care. Our hospitals, we were very concerned on the front end because we didn't know exactly what we were dealing with. And I was literally in the White House having lunch with a group of the leadership team with President Trump on January 24th when we talked about this, and he made the point that he'd been on the phone with Xi Jinping 2 or 3 times trying to get access, get our medical researchers to get access into Wuhan to try to figure out what we were dealing with. And Xi wouldn't allow it. And 4 days later, he suspended all travel into and out of China. And so our initial fear was, watching what was happening in Italy and other places, is that our healthcare system would collapse into one giant dumpster fire. So the first thing we should have learned was the lack of a supply of critical personal protection equipment for our healthcare workers and of medicine. All of a sudden, everybody realizes now how reliant we are on foreign sourced medicines. So that's where you start. And then the regulations that prohibited us or delayed us in getting the right medications out there. And I think that's still a problem. I think there's some misinformation out there about the use of legacy drugs that we know were really useful in treating for COVID. Hydroxychloroquine being among those, and there are other legacy drugs. It raises concerns to me about the influence of to a certain extent, of special interest groups who would rather the government spend billions of dollars on a new drug rather than use the inexpensive drugs that are already on the market. So I think that's something down the road we have to address. But in terms of preparing for this, I think we've got to become much more cautious in dealing with a nation like China, because I think until we find out how this really happened, and I have my own suspicions, which we won't get into here, I think we've got to be a little bit more circumspect about our relationship with China.
Thank you, Congressman. I very much appreciate that. You know, diving a little more into the forward-looking, I think you've raised a lot of really excellent points there, and one of which is that there were all these regulatory barriers, from testing having to be consolidated in Atlanta, which made for a really slow process, and the Trump administration did a really fantastic job in implementing waivers for folks who are participating in the Medicare set of services on telemedicine, particularly. I wonder if you could comment what the role of telemedicine ought to be going forward, and particularly with reference to folks in the state of Alabama and in your district.
Well, it's particularly important for people in rural areas that to really give people full access to telehealth. We've got to get our broadband system built out so that people have access to this. But I think one of the things we did during the pandemic was to try to make sure that doctors and physicians' assistants were reimbursed at a reasonable level when they were providing healthcare through telemedicine. And we were able to do that. I may have been the one that introduced the bill, at least I co-sponsored the bill, or I can't recall, but I was very engaged in that. I think in terms of the regulatory barriers to just trying to get approval for certain types of face mask and other materials was a multi-layered process that was ridiculous. That the CDC would be waiting on one testing group and the testing group would be waiting on somebody else. That's absurd. And to their credit, the Trump administration did a great job of just pushing this stuff through and taking away those barriers so that we were getting the materials that people needed. And I think the vaccine development is an example of what could be done if you take some of the barriers down. And the question that we ought to be asking right now is, why aren't we having an Operation Warp Speed on some other diseases that are so problematic in our country? Not that it guarantees a cure, but man, when you unleash the free market, the results can be, as they were in this case, spectacular.
I think that's exactly right. I mean, one of the great lessons, I think, of the pandemic was understanding what we could do if we simply allowed ourselves to go out and do these things. If we cut away the regulatory red tape, if we cut away the unnecessary oversight and just went out and did the job that we know that our amazing firms and businesses are able to do. And the story of American resilience across the entire breadth of the pandemic has been truly amazing. And also the story of American innovation, to your point about Operation Warp Speed. The mainstream media said that they would never get a vaccine under the timeline that the Trump administration laid out, and yet they did. They were able to do these things because they cut away the unnecessary things and focused on what was most important. Now,
we've become complacent in that respect, that we just accept the status quo because it's the way it's always been done. And Trump was what you would call a destructive innovator. He broke up systems. He did it in other areas. I chaired the subcommittee on intergovernmental affairs and worked very closely with the White House on major regulatory reforms, getting rid of the obsolete and the duplications and the contradictions. We'd never seen anybody operate like that. And I talked about the amendment that I introduced on covering pre-existing conditions. I had one meeting with the president, showed him what happened in the state of Maine and how it brought premium costs down for the whole population, lower even than adult non-smokers in neighboring New Hampshire who had the same insurance company. And he got it immediately. And he didn't send people out to do a poll to see if the public would approve this. He just says, get it done. That's destructive innovation. And we need that. And we need to unleash the ingenuity and the vision and the inspiration of the market. And it can be done in healthcare. And there's no telling what could be done in the area of healthcare if we did that. But let me give you an example of not how it works out not having that freedom and that flexibility. And all you got to do is look at Canada. Canada has a think tank, the Fraser Institute, that puts out a report on the mortality rates related to the wait times in Canada. And the average wait time is about 22 weeks for high-tech medicine for access to an MRI or a CAT scan. And they put out a report that showed I'll have to go back and check the dates, but I think it was between 1992 and 2005. They estimate that between 25,000 and 63,000 Canadian women died waiting for treatment. Oh, wow. That's what happens when you have a government-run healthcare system. They're funded on a quarterly basis, province by province. The doctors have a limit on how much they can earn, and it just kills innovation.
Absolutely.
And not to be flippant about it, but it kills people.
That's exactly right. I mean, we talk a lot in kind of conservative free market circles about the financial impact. What is the impact to the economy? What is the impact to the balance sheet? But we have to remember, of course, that these are terrible human consequences that come up. This is increased amounts of sickness, increased amounts of death. Fathers that may not see a child grow to full age, or a child that may not see their, mother, father, grandparent live to the ripe old age that they ought to, and that's just really tragic.
Well, the less healthy your workforce, it impacts the human capital part of that formula as well.
Mm-hmm.
And again, that's one of the reasons why I'm such a strong proponent of incentivizing people to live healthier lifestyles. Those who can, I understand that some people have genetic issues that compromise their health, but in the United States, our biggest issues are related to hypertension and diabetes and issues that are in many cases related to lifestyle. But if we can incentivize people through health savings accounts where they're spending their money and we let them keep what they don't spend, I think you can incentivize people to live healthier lifestyles and not only for their benefit, but for the overall benefit of the country, particularly our economy, because you improve your human capital.
That's absolutely right. We're talking a lot about incentives and so on. One of the proposals that some Democrats have put forward in Congress, HR 3, is an attempt to effectively incentivize pharmaceutical companies to import foreign price controls, often from socialist countries. And if they don't do so, they'll be hit with a extremely punitive tax. Now, Congressman, is this destructive innovation or is this just destructive?
It's just destructive. I mean, you will kill innovation and drug research. In Alabama, it's not in my district, we have Hudson Alpha, which is a co-op. It's a fabulous facility. The Human Genome Project is moved from Stanford in California to Hudson Alpha in Huntsville, Alabama. And you've got the entrepreneurs over here who will convert the research that's being done into companies to get these products on the market. And they're doing incredible research. I mean, world-leading research up there, but it's private money. And it takes an enormous amount of investment to create a marketable drug. There's tremendous amounts of stranded cost that has to be recovered. And you look at the countries that impose the price controls, they're taking American ingenuity, American creativity in the drug area and selling it in these other countries at what really are below market prices, forcing the American companies to have to recover their costs almost entirely in the United States. And we may get drugs at a lower cost if they do that, but we'll wind up being like having situations like they have in the United Kingdom, where there's 20-something, I think it's 25 cancer drugs that are commonly available in the United States that they can't get in the UK because the British healthcare system won't pay for them. And I'm talking about stuff to treat prostate cancer, breast cancer. This is not what we want, but this is what we'll get if the Democrats succeed in passing that bill.
That's absolutely right, Congressman. I wonder if you wouldn't mind now pivoting a little bit and discussing HR 1. It's a pretty topical issue this week. As you saw, Congressman, the bill HR 1 S1 in the Senate just failed, and I think that was a repudiation in a lot of ways of the attempt to mandate various kinds of controls over elections to partisan-ize, you might say, the Federal Election Commission, and to clamp down on Americans' rights of free speech and free association. I wonder if you would talk broadly about why this bill, HR 1 S1, is problematic and what our listeners should be aware of.
Well, first of all, it's unconstitutional. Article 1 and Article 2 both vest the authority for changing election laws in the state legislatures. That's largely the responsibility of the state legislatures to change their laws. And what happened in the last election in Pennsylvania was ground zero for this. You had everybody from the governor in Pennsylvania to the Pennsylvania State Supreme Court to county officials making changes to the election law under the pretense that that it was the pandemic that allowed them to do this. It happened all over the country. And we need to allow the states to make the reforms to their election laws that they need. And Florida is a perfect example of this. The 2000 election, Florida was a disaster by any account. But Florida took the responsibility to reform their laws. The 2020 election went off without a hitch. They've made additional reforms. There was tremendous pushback against the Georgia reforms, which were good. I don't think they went far enough, but they were good because it was Georgia. And what they didn't tell you was that Iowa passed even better reforms 2 weeks before Georgia. And HR 1 would be a disaster. It would federalize all the elections. It provides taxpayer funds to candidates, and it would fund any candidate. But you talk about advantaging incumbency, because those of us who are already in Congress have a base of support that's going to provide funding, and that would get matched, I think, on a 6-to-1 basis. It is to really, instead of For the People Act, it's for the Politicians Act, for the Incumbents Act, and they know what they're doing. It would take away some of the things that are critical to ballot security, like a photo ID, a signature verification. It would allow ballots to come in after the election. If you think ballot harvesting is a problem now, just wait till that happens. If they're behind by a few thousand votes, they'll go out and get people to vote, go door to door until they get enough to win. That's what they did in California in 2018. The American people need to wake up to this and defend their right to fair and free elections. And I'm all for election reform that makes it harder to cheat but easier to vote. I'm okay with early voting. I'm okay with voting by mail if that's your preference. Florida allowed all of that, Ted, and they had a great election. They did it exactly right. The other issue is, and this is interesting, is that it doesn't force the states to abide by a federal law, the 1993 National Voter Registration Act that we called Motor Voter Act. Was passed by majority Democrats in both houses of Congress and signed by Bill Clinton. And it requires that every state maintain accurate voter files. It's never been enforced. Los Angeles County had 1.5 million more people registered to vote than are old enough to vote who live in the county. 1.5 million is almost the population of Philadelphia. The state of Michigan is 105% registered to vote. They've got 16 counties that are over 110% registered to vote. Pennsylvania has over 800,000 improperly registered voters. The Pew Foundation, which nobody views the Pew Research Center as a conservative group, reported there are 24 million Americans improperly registered. 1.8 million of them are dead and 2.7 million of them are registered in more than one state. That's the key to an honest election, is to make sure that eligible voters have access to the polls or can vote by mail, but that we clean up the voter file so that we're not having literally millions of votes cast that are cast by people who don't even live there or deceased.
That's a great description, Congressman. I really appreciate that. And to be clear for our audience, HR 1, S1 did die in the Senate this week, but we do expect provisions similar to this to come back. The bills that are the component parts are similar to HR 1. For example, HR 4, the John Lewis Voting Rights Bill, the Honest Ads Act, the Disclose Act. These are going to be coming back up. These are going to be continuous fights, and ones that the grassroots and volunteers, folks who care about the future of America, are going to need to be well aware of and ready to push back on. And with that, Congressman, I'll ask you one last question and then hand it over to you to kind of close out in whatever way you'd like. But HR 1, more specifically the Disclose Act, targets free speech and association and chills civil discourse through provisions that would take the personal information of Americans who give to nonprofit organizations and take that information and put it into publicly searchable databases. Some people would call this a suppression on free speech or free association. Some people would call it cancel culture. Congressman, what would you call it? And what would you say the solution is going forward?
It's an attack on conservative groups. It will seriously undermine the ability of conservative organizations to function in the country. And having run a think tank for almost 25 years, I understand this, that privacy matters. And we saw an assault on conservative groups during the Obama administration with Lois Lerner. There was no question they were targeting conservative groups and doing audits. New groups that were trying to be formed, they withheld their tax exempt status approval. That's where this would lead, and it would be I think a major assault on the freedom of association that has always been protected by our laws. So I just would point out that I think we're at a pivotal point in our country's history. AFP has been a leader in the grassroots movement. And I try to tell people that we don't have to have everybody, but we have to have enough. We have to have enough people willing to volunteer. We have to have enough people willing to give money to organizations. And we have to have enough people willing to run for office. And I'm not talking about just running for Congress. I'm talking about at every level. And that's one of the things where AFP has, I think, done a great job, is recruiting volunteers, helping people learn how to participate and be effective in doing so. Because the real change that we need in the country will not come from the top down. It's going to come from the bottom up. So I appreciate you giving me an opportunity to talk to your group today. You tell Tim Phillips, I'm sorry he wasn't able to get on and participate, and I look forward to seeing him soon.
Absolutely. Thank you so much, Representative Palmer. Folks, if you are interested by the things you've heard here today, please go to afphq.org to learn more. You can also find us at our Facebook page. That's facebook.com/fightback. And we look forward to seeing you soon. Thanks so much.
Thank you.